Welcome to the Quimby Chronicles Momcast, where we talk about all things motherhood, family, and keeping your sanity through it all. On today's episode, we're talking about Black maternal health. We're using our personal experiences to highlight the need for community awareness and action to address these disparities and ensure safe and equitable maternal care for all women. Ready to join the conversation? Come on in.
Hey guys, welcome back to another episode of the Quimby Chronicles Momcast, where you guys already know we keep it real and relatable. I'm Chanté, and I'm here with my mom, Traci, today.
Hey y'all, hey Chanté. So today, in honor of Black Maternal Health Week, today we are going to talk about Black maternal health. So let me give you a little bit of insight on Black Maternal Health Week, and yes, I'm reading it from the website. Okay. So Black Maternal Health Week is a week-long campaign led by the Black Mamas Matter Alliance, which is focused on a lot of the things that we support here at the Quimby Chronicles. Okay. I'm talking about raising awareness, it's activism and community building to address the Black maternal health, the disparities in the Black maternal health outcomes. So, um, of course, this is something that is near and dear to our hearts because we're Black moms. We were part of the system. And, thinking back a lot of times, there's certain things that would be like, now, wait a minute. So, that's what we're going to talk about today. So grab your tea, your juice, your wine, your coffee, whatever. I got my coffee. And then what you got? What you got?
I got my coffee today, guys.
You got coffee? Okay.
I always forget, but this time I'm locked in. I got it this time.
Right. I support it. I support it. I support it. So grab your drink and then let's get into it.
All right, guys. So according to the CDC, Black women's mortality rate when it comes to pregnancy-related complications are almost 3 times higher than it is for white women pregnancy related complications.
Yeah. Which is crazy because you think about it, you have almost 3 Black women who die from things that white women survive or overcome more so because 3 times more is crazy. 3 times. That's crazy. In this country, you got Black women dying 3 times more, almost 3 times more than our white counterparts. Ridiculous. Ridiculous. You know, so full disclosure, I'm a nurse. I was a labor and delivery nurse for a short period of time. I was a postpartum nurse for about a year. And I will say, in that time, seeing behind the scenes all made so much more sense. Because in labor and delivery, over the course of my nursing career, labor and delivery and postpartum was a time where I took care of the greatest amount of Black women. Because in the other units I worked on, it was kind of like the population. It was a lot of Caucasians and Hispanics. Like it was a big mix and a lot of men. Women centered care, that was probably the shortest part of my nursing career. But in that time, and there's 2 instances that I think about all the time that just infuriates me. So the first one was a Black woman. She had, I want to say it was like her 11th child or something like that. She had been pregnant a lot of times. Either way, so knowing the science, every time a woman has a child, when the uterus goes to shrink back down, the pain is worse with each childbirth. It's worse. So here we are. This lady, she had an uncomplicated vaginal birth. Uh, so she came over to me and I worked night shift. So it was maybe 2 o'clock in the morning. And I went to check on her, and this lady was in tears from the cramping, from her uterus from shrinking back down. She was in tears. And she said, please help me. This Motrin is not cutting it. Now, at that time, standard, if you had a vaginal delivery, you're getting 800 milligram Motrin and you're getting some Tylenol. That's your pain medicine. That's standard. So I said, okay, well, let me call the doctor and get you something more. So I called the doctor. She had a vaginal delivery. She doesn't need anything more than Motrin. I was like, well, actually, she is in tears and she needs something a little bit stronger. Well, fine. I'll give her, I think they ordered naproxen. Ordered some naproxen. It took the edge off. The pain never went away. It never got to a point where she could get some sleep. So she called again. And I said, okay, well, let me call the doctor again. And when I tell you that I had to fight to get this lady appropriate pain medicine, I had to fight to get her appropriate pain medication. Now, on the opposite side, I had a patient, white lady, vaginal delivery, uncomplicated, like her third or fourth child. She came over. She had the, you know, same thing, 800 milligram Motrin and Tylenol. That's what you get. Around maybe 1 o'clock or so, she says, oh, I don't feel like the Motrin is working. Can you call and get me something different? Call the doctor and I said, hey, this is Tracy and I'm calling for a patient, yada, yada, yada. She's gravid of this, paradis, yada, yada. Give them the whole rundown. I got an order for narco. I got an order for hydrocodone for her, and it's just crazy that for the Black woman, I had to fight. I had to fight. For the white woman, I didn't. I just said, she's complaining of pain. She said the Motrin isn't helping. Can I have something stronger? She gets Norco. The Black lady that I finally got something for, she got a one-time dose of Norco. So I had to tell her, I'm like, look, if you feel like your pain isn't being managed properly, or you feel like you're not being treated properly, this is what I need you to do. And I would tell her what I would tell any patient: call the patient care advocate. If you feel like somebody's doing you a disservice, call the patient care advocate. If you're in a hospital, healthcare facility, call the patient care advocate. They'll get to the bottom of it. So that's the first story. The second one, so that story was about the doctors and the way they treat it. And mind you, let me be clear, it was the same doctor both times. Same doctor. Both the ladies, their clinical course was about the same. Only difference was the first patient, the Black lady, she had had more children. She had had more pregnancies. She'd given birth more times. That was the only difference. So the next situation is dealing with nurses. In nursing, it's just like anything else. A lot of units that you go to, the Black nurses will be in the minority, which, I mean, it is what it is. It's neither here nor there. So I had this patient. It was Christmas Eve, and she had given birth. So she was supposed to leave on Christmas Eve. She must have given birth on the 20, maybe like the 21st, early into the 22nd. Oh no, I lie. Like the 22nd, early into the 23rd. Because she was supposed to go home Christmas Eve. But I think her blood pressure spiked and, they kept her an additional day and stuff like that. I happened to be her nurse on Christmas Eve going into Christmas Day. Her blood pressure on Christmas Eve was fine. Perfect the entire day. So the doctor says, your blood pressure stays perfect, it stays within control overnight. You could go home in the morning. He put the order in the computer. If patient's blood pressure stays stable, patient may discharge home. So I'm like, cool, like that's perfect. Because we had a conversation and she was like, oh my gosh, I've never spent Christmas away from my children, and I just really want to get home in time to be able to celebrate with all my kids, blah, blah, blah. And I'm like, all right, look, I got you. I said, let's just make sure that this blood pressure stays respectful, because if it get disrespectful, you already know. And she was like, okay, okay, okay. The next morning before I leave, because normally day shift does discharges, and usually they'll start them around 8 o'clock, but she was anxious to get home. So I was like, okay, when I say I did the entire discharge, I did everything. The only thing the day shift nurse had to do was have that lady sign a piece of paper confirming her discharge teaching, and she had to take the security tag off the baby's leg and call for transport to have them wheeled out. That's it. That's it. So I'm giving a report and I tell the nurse, I said, hey, this lady, she's good. I told her about her clinical course, give her a report and stuff like that. I said, but she's really anxious to get home. She's never spent Christmas away from her kids, and she's really anxious to get home. The doctor put in orders that if her blood pressure stays stable, she can go home. Her blood pressure's been stable. I did the discharge paperwork. I did the actual discharge teaching. I said, all you have to do, give her the paperwork so she can sign it, cut the baby's tag off, and let them go. So the nurse looks at me and says, well, she just gonna have to wait till I get there. Cause I got this and I got that and I got this. I was like, you know what? Don't worry about it. Don't worry about it. Because at that moment, I was so furious. Because my whole thing is that as a nurse, I believe that you have to put yourself in your patient's shoes. Have a little humanity. It's Christmas Day. So what, are you mad because you're working? Now you want to make this lady stay here longer? It's nobody's fault that you gotta work Christmas Day. Like, that's not cool. So I did that patient's discharge, and then I let that nurse know about herself. I told her all about herself, because my thing is, had that been your daughter that wanted to get home in Christmas for get home in time to spend Christmas with her kids, you would have made sure. You would have bent over backwards. You'd have talked to whoever you needed to talk to. Had that been your sister, same thing. So what's the difference? What's the difference? But me and this nurse had issues before when it came to the dealings with, um, I'll say non-white patients, because I'm not going to just say black. Because with this nurse, whenever there were dealings with non-white patients, it was always some kind of conflict. So yeah, I mean, I see it. I see it from both sides. As a patient and as a caregiver, you see it. And it's sad and it's disheartening and it's infuriating to me. Because why would you even get into a business like that? Okay, well, the money. But why would you even get into a business like this if you're not here to take care of the patients, regardless of what they look like? That's our job. So yeah, those two times, like, I'm getting a little angry just even thinking about it, because let's be for real right now. And shoot, what the times when there is something I can do about it and where I can lend a voice to my patients, absolutely, I'm gonna do it hands down. And if it's us, what? Okay, come here, sis. Okay, let me tell you something. And it's crazy that it has to be that way, but it has to be that way. Unfortunately, it's just it's crazy. There's high rates. If you look up the statistics, there's high rates of Black women being ignored, their pain being ignored, their symptoms being ignored. Pain is a big one. The pain and the symptoms, very big. And then being dismissed, like, to feel like we're complaining, or if we ask a question, we're being aggressive. It's that's just the stigma that comes with being a Black woman in this country today. And being a Black woman seeking services from the healthcare system, you got to be very, very, very careful and try to have someone with you who can be an advocate, even if they're not in healthcare, just somebody that would be like, hey, what about this? Because people's perspectives are different. That was my personal experience as a caregiver, dealing with situations like that. But Chanté, I know you have a personal story.
Actually, because when you were sharing your experiences, it made me think further back than the ones that I was already going to tell. It made me think further back. So I'm just gonna break this down for you guys. I'm gonna try to keep it as simple as possible. But I remember when I was pregnant with my son. I remember when it came to finding a doctor, and like how my mom said that she's worked in, labor and delivery and postpartum. I'm thankful for that because my mom was able to recommend, OBs that she felt like I would be safe with. Like, I was very fortunate to be able to do that. And I was lucky because both of the OBs that she recommended, those were both of the ones that saw me throughout my first pregnancy. So I was very, very thankful for that. And, there was never any mistreatment, never any time that I felt like I was being ignored or anything like that. I felt like I was heard and seen and, all the good things. So I'm thankful that my mom was able to give those recommendations for me because she had worked, side by side by these OBs, and she sees how they work, she sees how they treat people, and she's like, okay, I know I would trust my daughter with them. I would trust my grandson that's going to be here with them. Like, I fully trust them. So that I was thankful for that because, not everybody gets to have those experiences. Not everybody has, that background knowledge because what if my mom had chosen a different line of work? I would have been like, okay, I hope this is going to be okay, instead of, okay, I know she'll be fine. I know that her baby will be fine, all that. So I'm going to jump forward to when it's actually time to have my son. So this is back in 2021. I remember so vividly how all of that went because, mind you, pregnancy with my son, it was awesome. No symptoms, nothing crazy, no morning sickness, nothing like that. No food aversions, none of that. Everything was fine. But the labor, that was a different story. That one had me bent out of shape a little bit. With my son, that labor and delivery, that had me a little shook. But I'm so thankful that I had my mom there to advocate for me because being a first time mom, and I'm 19 years old at this point. Like, that's young to be having your first baby. No judgment if that was the same thing for you or if you were even younger. But me personally, whoa, that was a lot at that age. That was a lot. So I'm so thankful that my mom was there to advocate for me because there were so many people coming in and asking me all these questions. And I'm sitting here trying to hold on for dear life because at this point, I'm already 9.5 centimeters dilated. Didn't even know if I would have enough time for my epidural, which, long story short, I kind of sort of didn't because by the time it took about half an hour for the epidural to actually get into play, and I didn't even get to enjoy it because it was already too late. So I got stuck for no reason. And how that went down, I remember this moment so vividly. So if you've gotten the epidural, you have to be sitting like this, you have to be, leaned over, and 9 times out of 10, you'll have somebody that's like close to like your knees or like where your feet are, sitting there trying to help you focus because what an epidural needle looks like is huge. Yeah, I was never the type of person to have issues with needles or anything like that. Like, that's never been me. I just wanted to stop. I don't care how big the needle was. I don't care how bad it hurt. I knew it wasn't going to hurt as bad as those contractions. So I wasn't even worried about that. I remember I believe she was a nurse that was trying to stick me. She stuck me wrong 3 separate times trying to get the epidural.
So she was a nurse anesthetist. So nurse anesthetists are advanced practice nurses. They go to special schooling and they can administer certain types of anesthesia and stuff like that under the direction of an anesthesiologist. So she was a nurse, but it's a CRNA. So she was a certified.
Okay, I've heard
and
that.
Yeah.
Okay. Yeah, clocking the knowledge. So after I was stuck the third time and it wasn't successful, then my mom cuts in like, okay, I think it's time to call the anesthesiologist back because after the third time, like, I was over it. And she said it still, and I'm like, sweetie, I'm trying. His head is about to pop out. I'm trying to sit as still as I can right now because, like I said, I was 9.5 centimeters dilated. So I was sitting as still as I possibly could at that point. So my mom's like, okay, it's time to call the anesthesiologist back. They get the anesthesiologist back in time, and I get the epidural. And then the minute I catch my breath, then my midwife comes back in and is like, okay, you ready to have a baby? I just caught my breath. No, I'm not ready to have a baby. No. And I will always remember my midwife forever. I remember my midwife. I won't say her name on here, but I do remember her name. That's how well I remember her. I remember her name, her face, all of that.
It was awesome.
Like, well, I was off at 7. Mind you, I had my 7 at my 7. I had my son at 7:15. She stayed past to make sure that she was there for me instead of like, oh no, I'm clocked out at 7. That's it. Get somebody else on rotation. She was there to make sure that she was there for me when I had my son because, long story short, earlier in this day, I was already at the hospital for a couple of hours, but my labor wasn't progressing. So she was like, well, we can either have you stay in here, you chill out a little bit longer, see if you progress, or you can go home. And I'm like, oh, that's all you had to say. I'll go home because I lay down in my bed. I was tired. I was hurting. It was a lot, and the labor wasn't progressing. So that's how the whole 9.5 centimeter thing started because I I don't know if I was in denial. I really don't know what it was, but by the time I made my way over to my mom's room, I'm like, Mom, I can't do it. We gotta go. And she's like, okay, let's go hop in the shower. My mom, she literally had to bathe me head to toe and put lotion on me head to toe because I couldn't move. Once she told me to get in the shower. Once she saw that I couldn't even stand up in the shower, she's like, okay, yeah, it's time to go. So she gets the bags together and everything. She calls my husband because he was at work at the time. She calls him when we're at the hospital. She's like, "Hey, you need to get down here like now. It's go time. You need to get here." And thankfully he made it in time and all that. But if I didn't have my mom, my goodness, because all these different phrases and things that they're asking me and things that they're saying to me, I'm confused. I'm in pain. I don't know what's going on. My mom is like, "Oh, well, this, that, and that, this is that, this means this." Like I was more than confused.
Right.
All of that is still a blur, but I remember enough to know that I knew that my mom was there advocating for me. I knew because she knew, obviously, she knew what was going on. She knew what the medications were. She knew all the lingo and all those things. So I am so thankful that that was the line of work that my mom chose because she knew just about everything for everything that they were asking and talking about and all that. Because with my son, it was close to like 10 people in that labor and delivery room. It was a lot of people in there. And it was already traumatic enough because when my son came out, he wasn't breathing. His little body was limp and purple. Like I was freaking out. My mom's like, "Okay, talking to my husband, like, okay, you stay here with her. I'm gonna go over with the baby and watch over that because I'm sitting here crying hysterically. I know the nurse is trying to calm me down. My husband's trying to calm me down. I'm blocking out everything and just listening out for that cry because he still wasn't crying yet. I was freaking out. I was bad. It was really bad. But, we both made it through healthy and fine. But that was insane because that I've never seen anything like that in my life. Like obviously I've seen the movies and stuff like that, but that's nothing compared to actually going through it real in person. Like that was scary. And then let's fast forward a couple years to when it's time to have my daughter. My mom was still also there advocating for me because if you guys don't know, I gave birth to my daughter in a car on the side of the road.
Excuse me, it was a Ford Explorer. Don't do that. Okay.
Or she was nice and comfy and deluxe, but it was still on the side of the road. It was bad. So how that happened, it genuinely caught me by surprise because I was literally sleeping. And I fell asleep in a bathtub when I was in active labor, and I didn't realize it was that serious until I had one contraction that it really, like, I had to look down and check because I'm like, what was that? And I was like, I started screaming for my mom. I am screaming at the top of my lungs. My husband comes and busts in the bathroom. He's like, "What are you doing? What's going on? What's happening?" He's trying to find clothes to put on because, mind you, my daughter was late at this point. So this was already past my due. It was 4 days past my due date already. So, the bags were already packed and all that ready to go. But we were trying to find clothes for me to put on. My mom said, because how she's sounding and looking, she doesn't have time for that. So my mom had to put me in her robe. And mind you, the robe was so short on me and it was a freezing cold outside. That didn't even matter. Compared to those contractions, it didn't even matter. So then mom was trying to help me walk to the car, and I'm sitting there and I have this one contraction. It hurt so bad. It hurt so bad. And mom said, "Ooh, no." She said, She said, "Okay, come on, let's sit down, let's go. There's no time to do anything." Because I think I was asking about like Gatorade or something. She said,
Yeah.
"No."
Can you grab my Gatorade?
And she said, "No, we'll worry about it later. Get in the car." She wasn't trying to hear anything. I was genuinely delirious. And I'm like, "Oh, my Gatorade, I'm thirsty." She said, "Shantae, just get in the car." And I was like, "Okay, yeah, you got it. You got it." We're sitting in the car going down the street. We didn't even make it out of the neighborhood, mind you. When I say on the side of the road, we weren't even out of the neighborhood yet. And my dad's calling and my husband's calling. They're calling, and 911 isn't answering. And my mom's like, "Oh man," I forgot who my mom was on the phone with at the time. She was like, "I gotta go. This baby's not gonna make it to the hospital." Next thing you know, my mom, she comes in the back. So if you guys don't know how the inside of a Ford Explorer looks, my dad has the one where it's like the bucket seats. So there's not one in the middle. So it's, the two front seats, two middle, and then three in the back. Me and my husband are sitting in the two in the second row, and my mom, she's like, "Okay, there was this one contraction that I had," and I was like, "Mom, I feel something. Her head is out." And my mom said, "Oh, yep, pull over, pull over." My mom, she gets in the back and she's looking and she's like, Okay. And then she's like, yeah, I'm gonna need you to flip over. I only had to push once, which I was really trying not to because we were in a car. I was really trying not to push, but at that point I couldn't help it. She was ready. She didn't give me any time. I was like, okay, girl, yep, my bad. So my mom, she's like, no, you gotta flip over on all fours, and her body literally just falls out, and my mom catches her, and I'm like, did I just give birth in a car? And my mom, she gets back in the car, she sits like this, clicks her seatbelt, she said, well, I just delivered my grandbaby. Okay, the hospital, and everything just felt so calm and peaceful in that moment up until we get to the hospital sitting there because mind you, my daughter's out, but placenta isn't out yet. So, she's still technically attached to me. I have her wrapped as best I could. And, I have all my business hanging out because I'm just making sure because she's wet. She doesn't have any clothes on. I'm trying to make sure she's wrapped good as possible. I'll worry about me later. Like I'm still in mom mode. I'll worry about wrapping myself later. This is cool. My mom goes in and she's like, hey, so my daughter gave birth on the side of the road and she remember her telling me how big their eyes got when she said that. And there's four nurses, three of them were men, and one of them was a woman. Because I remember the woman, she was there for when my mom actually knows her. She was there for when I had my son. And she was there the second time too. She was like, oh yeah, I was wondering why you look so familiar. But the last time she saw my mom was before she cut all her hair off. So she didn't really recognize my mom at first. And she was like, oh my goodness. And I was like, yeah, you were here for both my babies. Look at that. But my mom, she's like, okay, like, placenta's still attached. The first thing they do when they get over there is trying to take the baby from my arms. And I'm like, you can't do that. You can't do that. Like, you can't just take her from me. She still has to be like with me because she's still attached. So I'm like,
So then,
okay.
yeah.
So then the nurse that I'm talking about that my mom knows, the woman, she was like, okay, guys, you need to help her get out, not take the baby. My mom was, trying to help my husband get the bags out of the bags. So she's like, you need to put her in the wheelchair, not take the baby and then her. You have to take them together. So they have me in what is it? What is it called? The rooms like when they have in the ER behind the curtains. It's called base.
Hallway back. I don't know what they call them. I don't know.
Well, whatever. I was in one of those little rooms that, you close by the curtain and there's like so many people surrounding me. Like I was in shock because my husband wasn't back yet. And my mom was, I don't even know where my mom was at the time, but it was just me and I had my daughter.
I couldn't come in. I couldn't come back with you. It was only one person.
No, but this was before they brought us up though.
Yeah, but I didn't come in because only Danny could come in. Remember, Danny was doing the paperwork and stuff. Yeah, I left after we dropped y'all.
Sure that we were settled and all that, but I don't know what I thought.
Yeah.
I obviously, clearly, I was razzled. I was definitely in shock. I've never seen so many people surrounding me, and there's so many people asking me questions and just all types of stuff. And I remember there was this one nurse that I had, and like I said, it was just me. Like my husband didn't make it back yet. My mom was getting ready to go home. Like she was sitting in the car waiting until we got, because I remember hearing her say, call me when you guys get settled. But obviously I'm sitting in the ER and there's like 5,000 people around me. So I clearly wasn't settled yet. So my husband, like my mom said, my husband was doing the paperwork and I'm sitting there like, oh my goodness. There was one nurse that literally told like four people, she said, shut up. But I was going to say she told them to be quiet, but no, she told them to shut up. She said, obviously she has a lot going on right now. These questions can wait because, like I said, placenta's still attached. So they need to finish the actual labor and delivery process before all these people are asking me questions. And I'm like, I can't think right now. Like I was genuinely like dissociated. I was just looking around like because I couldn't hear anything that they were saying at the time. It's just like they were talking to me and I wasn't catching any of it.
Yeah.
None of catching any of that. But I am so thankful that that nurse was there because there were so many people asking me 5,000 questions. And I'm literally sitting there in shock. Like, I just had a baby in a car. I can't think right now. Like, can I get like 5 minutes, please? Like, just chill, relax. Just give me a second. Let me, because when it's just a nice feeling having, in, like I said, that nurse, never seen her before, don't even know her. And she advocated for me when I needed it and she saw that no one else was there. because my mom was getting ready to go back home. My husband wasn't there doing the paperwork, and he still had to get the bags up to the room and everything. She was the one that told them to stop talking to me, and she took me up to. I was only in that labor delivery room for like. Now I don't even think I was in there for a full hour, to be complete, before I got moved over, because she was already born. Yeah. So they were asking questions after we get into the room that they put you in for recovery, and I'm like, okay, now I can actually answer some questions.
All right.
I remember telling my mom when I called her, this was, I think, the next day, they were coming to draw my blood. And I don't know what exactly her job title was, but she's the one that I want to say like lab tech or something. Probably who?
Lobotomist.
Oh, okay. I thought it was phlebotomist, but I didn't know if phlebotomist worked like in actual like hospitals like that. I thought it was just at like, at the blood draw centers and where they do labs and stuff. So when I tell you, like I told you guys, I've never had an issue with needles. Like whenever my blood gets drawn, like I'm the person to sit there and watch, because it doesn't phase me. But when I tell you the way that I was stuck, I literally jumped and like yanked my arm back because it hurt that bad. She's gonna grab my arm again, talking about sit still. Yes, I'm okay. Thank you for asking, because that hurt a lot. I'm never the type to have an issue with needles. When I told my mom that, she said, you should have told her to get you something else. And I was like, honestly, I didn't even know I could do that. I really didn't, because
Always.
all the piercings and tattoos and blood that I've had drawn, I've never had an issue. Like my mom has seen me sit there get piercings. I don't move, I don't jerk. Like I'm not that person to like jump and like react physically. I may say ow, but like no, I jumped and yanked my arm back, and I remember it's like bruise about this big on my arm for like it was a couple weeks, and it still hurt like to the chest. Like if I had touched it, it would still hurt. It was for a long time. And she's like, yeah, you definitely should have told her to get you someone else. And I was like, honestly, I didn't even know that I could do that. And you see, that's why I was so thankful the first time. But I mean, now I know for next time that I like the options that I have as a patient, the options right ever that I have that I'm able to take. Now I know it's a nice thing having people there to advocate for you, because if it wasn't for my mom, who knows how all of those situations would have went down. If I didn't have my mom there to deliver my daughter in a car, like what would have happened? And I was so scared because with my son, the cord was wrapped around his neck twice and he wasn't breathing at first. Like I had so much fear going through my head, and my mom was there. I still remember my mom coaching me through the labor with my son, like, unfurl your eyebrows, because if you're using all the energy on your eyebrows, you can't use it to push. And I'm like, oh my gosh, I can't breathe. This hurts. Everything was just hurting. It was a lot. It was really a lot. But I am so, so thankful that I had my mom there, and the nurse that she knows, that advocated for me with my daughter. I was thankful. My midwife, I was thankful to have all of them there advocating for me, because it really could have went in a different direction if I had got a different team that wasn't, I don't really know how to say it, wasn't really looking out for my best interests, I'll say.
Right.
That's probably the nicest way I can word that. So I'm definitely thankful that I had all those people on both of my teams there to advocate for me, because that could have went a lot worse both times.
Again, we have yapped quite a bit today, but this is definitely a topic, and all of our topics are near and dear to our heart. But anything that involves the kids is even nearer and dearer. Okay, so if this has moved you in any way, you learned one thing from this, you empathize with anything that we've gone through, or you've gone through the same thing or worse, let us know. Let us know, and share it with a mom who could use it. Share it with a mom who has insight to give. Because like we always say, we want to build a community. So let's get this community popping, okay? And remember, we deserve joy, we deserve support, and we deserve safe birth. Absolutely. Because there's no way that we should be dying at 2.5 times the rate of our counterparts. It's ridiculous. So, let's band together and let's do this. So that is it for us today. Finally, right? That is it for us today. So make sure, what is it, Chanté? Because
and subscribe. And we're on Instagram, we're on TikTok, we're on YouTube, Apple, Spotify.
I gotta get us on Facebook.
It. You on a Facebook?
Yeah, I'll do a Facebook page.
Up there on Facebook, but it doesn't transfer over to Instagram, so it doesn't really do me much good. Stuff that's just like, like how if you post on Instagram, you could automatically post to Facebook. It'll be posts that I see on Facebook that don't coincide with Instagram.
Okay. Yeah.
They're not like together.
Yeah, because right now, if I post to Instagram, it goes to my personal Facebook.
Oh, okay. I've seen that. I've seen like on your the stuff and stuff like that. Okay.
Yeah. I'll definitely get us Quimby Chronicles Facebook page. I'm gonna work on it. Okay. That's on my to-do list. But until next time, we love y'all. We appreciate y'all so much for tuning in and for watching us on YouTube. And, nobody really listens to us on Spotify, but whatever. As long as you get the message, we don't care where you get it from. So we definitely appreciate you. And until next week, keep growing, keep glowing, and let's take care of each other.
Thanks for tuning into the Quimby Chronicles Momcast. Don't forget to subscribe, share this episode, and join us next time as we tackle more of the beautiful chaos that is motherhood.